Now you're going to see why I love high-low tables and I hate these tables. Okay.
Yeah, that's true.
So myofascial release. Okay. Again, non-gliding fascial retraction with varying amounts of stretch now, and you'll see. So what I'm going to do is, as in the picture, I'm going to put both my hands on the patient. Okay. But first, where are your restrictions that you have?
It's more upper trap.
Upper trap on both sides or
both
one side?
sides.
Okay. So I'm going to focus on this side since I'm on this side right now. Okay. So if I'm going to focus on the upper trap using a myofascial technique, I want to anchor both ends of the traps. So upper traps, proximal and distal attachments.
Nuchal line. C7, T6.
I heard C7, T6, nuchal line.
T6.
What's the proximal attachment for the upper trap?
External.
And
C.
spinous process is
C7 to T12.
and distal attachments.
Spinous scap.
Struggling. Innervation? Cranial nerve, which is spinal accessory. Yeah, okay. These might be quiz questions. Okay. So I need to know that because that's where I'm going to anchor down the muscles, and that's where I'm going to place my hands. Now, if it's upper trap, again, it depends on the patient, depends on you, depends on the table they're on. Luckily, this can go up and down. Okay. To determine how I'm going to apply the pressure. Okay. Now, typically, if this was an actual patient, I'd be standing over here. But since you guys are filming, I'm going to stand over here so you guys can see. Okay. So if I'm standing over here, I'm going to anchor it down at both positions and apply pressure such that my hands are moving away from each other. Okay. Now, she's in cervical neutral right now. If I am progressing with this technique, I may want to have her side bend away to get more range of motion, to put the structures more taut, to try to get more release of restrictions. Does everyone see that? Okay. But again, it depends on the muscle you're targeting, depends on their body type, and now you can see why it depends on the table too. Okay. Anchor at the spine of the scap, other end at the spine itself. Okay. And just apply a opposite force, if you will. Okay. Now I want to engage the deeper muscles. Okay. But I don't want to push too hard because then I'm going to be pushing your face into the table. I'm just anchoring it down such that I'm trying to ease restrictions. So in other words, my direction of force is not necessarily inferior. Okay. It's a little bit inferior, but it's more. It's not really. Yeah, well, lateral, away from me. Okay. So instead of this way, it's more that way, like this, and then with the spine of the scap, the opposite direction, and I just apply deep pressure like this. How's that feel?
Good.
Good. Okay. Now, this is what I hold on for a while. The slide, I believe, says like 90 seconds to, I forgot what it says. Okay. But this is when you apply it in a deep, sustained time. Okay? Because you're constantly, again, asking the patient how it feels. You're using your hands as well to gauge, are the restrictions easing up? Okay? So how's that feel now?
Good. And you can put more pressure.
More pressure? Good. She's giving me good feedback, so let me apply more pressure. Now, because it's hard for me to get a good mechanical advantage here, I'm going to apply what's known as a skin lock. A skin lock is I put my hand down, but I kind of rotate my shoulder such that I am creating a vortex on the skin there to quote-unquote lock the skin such that the skin won't glide as much. So that way, when I apply the pressure this way, I'm actually engaging more of the subcutaneous tissue as opposed to just sliding on the skin. That's what a skin lock is. Okay, so I'm going to apply a skin lock like that and glide. How's that feel?
Good.
Good. Okay?
Yeah, that's good.
Okay, so again, depending upon how she's tolerating it, to progress, I may actually have her sit up just so I can get her into more side bending. So sit up.
Like up?
Yeah, sit. Facing like this. Oh no, sit here though. Sit here, just face everybody. Like that.
Face everybody. You're facing the wall.
Thank you.
I don't know how to like
That's fine.
Okay.
However you're comfortable. Okay. So this way, what I can do now, this way I don't necessarily go to right away because when they're upright, they're engaging their upper traps. So in other words, it's hard to promote relaxation. So I really want to make sure they're nice and relaxed. So relax your neck, relax. Good. Then I'm actually going to have her side bend away. I just want you to relax. Sometimes I even put a pillow here so they can rest their head. Okay? And then apply a myofascial release in this direction. I may still want to do a skin lock here. But again, depending on how she feels. Now, in this position, I'm not necessarily applying force with this hand. I'm just preventing her head from coming back to neutral. Really, at this position, my force is more in this hand in a more inferior direction away from her neck. How does that feel?
That's good.
Yeah. Is it too much?
No,
Want to ice it a bit?
No, you're good.
Okay.
You're good. Yep.
All right. Always keep in mind that patients are going to really want to please you. So when I ask, does this feel good? And the patient says, yeah, it feels great. I might want to back off a little bit. Okay? But I can already feel her relaxing under my hands right now. Okay? Because it's starting to become a little easier to apply this downward force. Okay? And then I reassess. How's
So what's
that
the
feel now?
difference between like this and a stretch?
Hmm?
Like, what would be like the difference between this and a stretch?
Well, a stretch is you just hold it in one position, whereas again, this is, go back to that slide, what's that? Non-gliding fascial traction with stretch. So in other words, it's applying the traction with a stretch.
Okay.
Okay,
So moving the tissue once she's in that stretch.
pretty much, yeah, okay. So in other words, she herself can do the stretch, but I'm also applying a little bit more force to get more mobility in all the tissues. Yeah. Think of it as a stretch on steroids. Okay?
So when you're doing that and she's on her stomach, are you like actively pushing down and away, or are you just pushing?
With which hand though?
Both.
Well, since she was in that neutral position, I wasn't pushing as much here because I didn't want to shove her face into the hole. Okay? This is more so that as I apply this force, this won't want to come down with it.
Okay.
In other words, I'm just trying to anchor it down.
But you are pushing down.
With this one I was, yeah. And not necessarily inferior, but a little bit more lateral. Okay? All right? So that's my fascial release. Okay, skin rolling is pretty straightforward. And we'll actually do a little bit more of that when we get to the elbow. But for now, let's practice on the shoulder area. So grab a partner, practice deep frictions, cross frictions, circular frictions, and myofascial release.